letter at all, and only for myself and Carol phoning and putting pressure. Tony wouldn't have been in the system at all.
The first thing that we identified was getting a follow-up appointment when you're discharged from hospital. We felt that this was something that we could possibly get quick and effective change on, and that it wouldn't require many resources.
The Mater Hospital issued guidance on follow-up procedures in its discharge protocol of February 2007. It states that, while the timing of follow-up is an issue to be decided by local clinicians, they should be aware of national guidance. National guidance states that all discharged patients who have severe mental illness or a recent history of deliberate self-harm should be followed up within a week. The group survey revealed that only 13% of those discharged from hospital after mental health treatment had received a follow-up appointment within a week. The group then set indicators of what change they would like to see and a timetable for that change to happen. In 6 months, the group wants the number of people receiving follow-up within a week to increase to 45%. Within a year, the group would like to see a system in place ensuring that 90% receive their follow-up within a week.
But there's simple things, like when people are discharged from hospital and are a psychiatric unit, why do they not give them an appointment card? Why wait on a letter? A letter that doesn't arrive, in our case, a letter never arrived. You know, why not give somebody a wee card to turn around and say, you will be seen at this time, on this date, on this day. And, because that's a lifeline. It's a lifeline to the patient, it's a lifeline to the carers, knowing that they're not going to be lost in the system, knowing they've got a target, knowing that they're somewhere going to be there.
This is a small issue, but one that would make a huge difference to families and at a local level on the ground if it was addressed. And as a result, the group, as you can imagine, is keen to see it happen quickly.
In the human rights perspective, it's very important to underscore the voice of users of services as monitoring services, and the notion that indicators and benchmarks are a way of assessing the progressive realization of rights.
What is different about this project is actually creating indicators and benchmarks and monitoring those with respect to specific problems.
Participation is the most important indicator that you've identified, but I think it's the most challenging if it's going to be done properly in a meaningful way.
The right of individuals and groups to participate in decisions which affect their lives is a key part of the right to health. The group's baseline survey found that 79% of mental health service users rated their level of involvement as low, between 1 and 3 on a scale of 1 to 10. In 6 months, the group wants this figure reduced to 65%, and in a year to 50%. This would provide the group with evidence that government is progressively realising their right to participate.
And they've now involved us more. And they've seen our point and how left out we had felt, and we feel a bit comfortable, we feel a wee bit better. You know, we think the recommendations, well, we're hoping the recommendations will be implemented. If it says that to Megan and Jim say that if all these recommendations are implemented, lives will be saved. You know, no question about it.
Or consultation does not necessarily signify participation.
Participation must be active, free and meaningful. In practice, this should mean the voices of mental health service users are sought out.
Using human rights, a human rights-based approach to do something, and I think that's really what human rights is about. It's about people.
Formal channels for participation, are they adequate or not? An answer on this could be that because the channels are inadequate, people feel that they have no place to participate and they don't get involved. So one question is to review how is participation enshrined in formal mechanisms in order to have the voices of users and families in the process of decision making and evaluation.
The phrase used earlier of a journey towards rights, I think that's a journey that we're very much just starting out on.
With respect to poverty, for example, we have indicators that are showing wonderful progress while poverty is increasing because they're not measuring the right things. It's why it's so important that communities are the ones who themselves define what the indicators are, to make sure that the indicators truly serve as a metric for human well-being. And then to be able to carry forth the lessons that are learned here to other struggles in other parts of the world.
Essentially, we have been talking about basic human rights. We're not asking for anything very exceptional here today. And I think that's been underlined over and over by the panel, that these kind of hopes that you have for the next 12 months are absolutely achievable, and they're quite just and reasonable. But we just need to set those rights in action. Thank you.
The work of the group has shown their commitment and dedication to making mental health services better for their communities. The next step in the journey involves requesting the Health Minister to match this commitment by providing support to address the issues they have highlighted, and in doing so to make their rights real.